Hi, my name is Kenna, and this is my presentation on the effects of forgiveness therapy on anger and life satisfaction in a grieving adult. The purpose of this project was to see if I could help a suicide-bereaved client reduce levels of anger and increase life satisfaction through a forgiveness intervention. Anger is a really common symptom of grief, and while it's not necessarily harmful in and of itself, research has linked it to unhealthy forms of grieving. Anger is especially problematic when it is long-term. Research indicates that this type of anger can have a detrimental impact on many aspects of mental, emotional, and even physical health. The amount of satisfaction one feels with their life has implications for mental and physical health as well. Low levels may predict higher levels of anger, whereas high levels of life satisfaction are correlated with better relationships, occupational satisfaction, and overall health. Research has found many benefits of forgiveness on mental health. Of particular importance for the purpose of my research, it has been shown to decrease anger and is correlated with higher life satisfaction. The subject of my research was a white male in his early 60s who presented for grief counseling after his father died. During the course of therapy, it became apparent that the client was also experiencing unresolved anger at his mother, who died by suicide 5 years ago. The client reported persistent feelings of anger and resentment toward his mother, as well as extremely low levels of life satisfaction. The intervention involved a 4-phase approach using the forgiveness therapy worksheet, which is based on Enright and Fitzgibbon's evidence-based forgiveness therapy model. Here's a brief overview of the worksheet. In phase 1, the client identifies the injuries that occurred and the impact they've had on the client. Phase 2 involves defining forgiveness and weighing the pros and cons of forgiving the offender. In phase 3, the client works to see the offender in a new way in order to foster more positive feelings toward the offender and toward self. Phase 4 asks the client to examine the positive changes and personal growth that have occurred as a result of forgiveness work. Each week, I introduced one of the phases to the client and provided him with the corresponding writing prompts to complete before our next session. His responses were processed at the beginning of each session. Levels of anger and blame, satisfaction with life, and forgiveness were all measured before the introduction of phase 1 and after processing phase 4. I used 3 empirically validated scales to measure outcomes: the satisfaction with life scale, the anger and blame subscale of the Hogan Grief Reaction Checklist, and the Heartland Forgiveness Scale. And here are the results. Satisfaction with life increased only slightly from a 6 to a 9. That score still falls within the range of extremely dissatisfied, with 10 being the cutoff. Anger, however, decreased from a score of 23 to a score of 15 on a scale that ranges from 7 to 35, so a significant improvement. Forgiveness also increased a moderate amount, from 59 to 76, with the highest possible score being 126. Other observations that we noted but didn't measure: the client cited increases in self-awareness, increased time between anger triggers and responses, increased willingness to take responsibility for self, and more positive thoughts of the deceased. Forgiveness therapy does seem to be a promising intervention for reducing anger and increasing forgiveness in grieving adults. It did not seem to greatly impact life satisfaction. However, the effects of COVID-19 on economic and social well-being may have been a compounding variable. More research is needed to determine forgiveness therapy's impact on this measure. Other limitations include small sample size, meaning the results are not necessarily generalizable, and the use of self-report measures, which have been criticized for lacking validity. Future studies should include more and more diverse subjects and utilize a true experimental design. It may also be worth exploring other avenues for increasing life satisfaction, measuring other outcomes such as anxiety or relational functioning, and studying other forms of grief and loss, such as death by overdose or related to substance use disorder, death of estranged or abusive family members, and even normal bereavement. If you're interested in learning more about the topics covered in this presentation, I've included a list of my references for further reading. And that concludes my presentation. Thank you so much for watching, for listening, and be well.